call on the podium Devansh Kansal. Is Devansh there? Yeah, so Devansh will be presenting a case on optic nerve infiltration in acute lymphoblastic leukemia, unraveling the visual impact. Over to you, Devansh.
Good morning, everybody. My topic of presentation is optic nerve infiltration in acute lymphoblastic leukemia, unraveling the visual impact. ALL is a malignant hematological disease presenting clinically with proliferation of immature lymphatic cells in the bone marrow and peripheral blood. Ocular symptoms can occur in different stages of ALL. They can be the first manifestation of leukemia, either primary or secondary. It can occur after diagnosis has been established or be the first sign of the relapse after remission. Secondary ocular manifestations include retinal hemorrhage and retinal venous occlusions due to hematological abnormalities. Intraocular involvement with infiltration of the optic nerve and associated optic swelling and fundus hemorrhages can occur. So a 16-year-old male patient, a known case of T-cell ALL, on treatment with augmented BFM protocol as chemotherapy. And 3 months after the chemotherapy was started, he complained of bilateral sudden loss of vision in both the eyes. And on ocular examination, the perception of light was negative in both the eyes, and the fundus examination revealed both eyes disc edema with pallor with peripapillary superficial hemorrhages, exudates with dot hemorrhages at the posterior pole. MRI of the brain and orbit revealed right intraorbital, left intraorbital, intracranial portions of optic nerve appear thickened, tortuous with post-contrast enhancement involving sheath, which is suggestive of leukemic infiltration of the optic nerve. So the diagnosis was made bilateral infiltrate optic neuropathy with right cilio-retinal artery occlusion, which is suggestive of relapse of T-cell acute lymphoblastic leukemia. So the treatment which was given was ALL protocol augmented BFM therapy, which includes induction phase, interim maintenance phase, and delayed intensification and maintenance phase. So our patient was on interim maintenance phase when he developed sudden bilateral loss of vision. An MRI of the brain and orbit and CSF study to look for leukemic cells can help guide urgent management of leukemic optic neuropathy. The management of L1 is multidisciplinary. Patient with L1 may require intrathecal chemotherapy and orbital radiation, and prompt oncology consultation is recommended for all the cases. Discussion: ocular findings in leukemia is due to leukemia and induced hyperviscosity status, medications used in treatment of leukemia, and immunosuppressive state. Choroid and retina are the most common site of involvement in leukemia. Optic nerve involvement could be a life-threatening sign. Disc edema in a leukemia patient could be due to direct infiltration of the optic disc leukemic cells, papillary edema due to increased intracranial tension, hydrocephalus caused by CNS leukemia. These are the causes which can cause disc edema in a leukemia patient. So conclusion is, this case highlights the clinical and imaging findings of bilateral optic nerve leukemic infiltration as a site of initial relapse of T-cell ALL. Disc edema in a case of leukemia is an indication for urgent CNS radiation treatment. As the survival rates after treatment, after therapy for leukemia is increasing and the quality of life parameters are becoming more important, the role of ophthalmologists in the holistic management of patients with this condition is also increasing. It underscores the significance of multidisciplinary collaboration between hematologists, oncologists, and ophthalmologists in optimizing patients' outcomes. These are references.
Yeah, great case, Devansh. So if you can just summarize for the audience, what were the fundus findings you found in this patient? Because what I understand, this was not a known case of ALL.
This was a known case of ALL. For the past 3 months, he was on chemotherapy.
Okay, so what are the fundus findings that you see in these cases that will help us? It might be the case that they present with the ocular findings, no? So if you can just summarize what were the findings on fundus that you saw.
The fundus findings can be the fundus findings can be superficial hemorrhages, dot hemorrhages, rough spots can be seen, and disc edema can be seen, and ultimately the optic nerve can get involved.
Yeah. So how does the rough spot look like?
The rough spots is the hemorrhage with a central white spot in between.
Yeah, central. Okay, thank you, Devansh.